Okay, all. Seems like I'm going to have to just go ahead and start using the computer microphone. I'm hoping that the audio is good enough. And if you're having any difficulties hearing me, just let me know. But I'm hoping everyone is doing well tonight. And it is indeed my distinct pleasure to be able to have yet another patient health workshop. I'm going to try to see if we can end as close as possible to the 7 o'clock. So, without further ado, is everyone hearing me okay? Just please indicate in the chat so that I can know that everyone is hearing me fine, and then we'll go ahead and begin. All right. So, I'm just waiting. All right. Okay, so let us begin. The topic for tonight is the 7 keys to getting and staying well. The 7 keys to getting and staying well. Now, I'm going to go ahead and bring up our PowerPoint for some of our basic information. We have the name of our practice, address, and phone numbers. Our contact information is on screen. Feel free to join in, and if you need to contact us by any means, please feel free to do so. All right. So the topic for today, 7 keys to getting and staying well, involves 7 key things that we ought to know if we want to ensure that we live a wellness lifestyle. We want to be as healthy as possible for as long as possible. And, well, that's the goal for many persons. The unfortunate reality is that most people have no clue what is required in order to do so. The rest of the persons who have a clue don't have the motivation to follow it through. So it is my hope that as a result of this class, you will come to a place of, one, understanding, where you will know what you need to do in order to be well, and two, that you'll be a little bit more motivated to do the necessary things to attain wellness. So that's where I'm at. All right, so let us begin, shall we? So the first key is understanding the difference between sick care and health care. And when it comes to the system that we call the healthcare system, we often, because of the name healthcare system, most persons assume that the system is focused on helping people to achieve or attain health. Now, you have to understand the health continuum before we move further. Health exists on a spectrum. Health is not just a static entity. Health is something that is always moving. It's never stationary. It's always in motion. It is one of those things that is, I guess, if you were to think about perpetual motion, where you are on the healthcare spectrum is a perpetual motion type of deal. So when we talk about that, we want to understand that optimal health, if optimal health is up here and death and disease is down here, we want to ensure that we are closer to the top and further away from down here. Now, the health continuum is the line that connects the 2 points: death and disease, optimal health, and vitality. Now, on this continuum, you're either somewhere moving upwards or moving downwards. You're never stationary. And every decision that we make will move us either a step closer to optimal health and vitality or move us closer to death and disease. Any movement toward death and disease is considered to be illness, an illness movement. Any movement that moves toward optimal health and vitality is considered wellness. So when you think about illness, you're moving toward disease and death. When you think about wellness, you're moving toward optimal health and vitality. That's just so you understand the terms. So when we look at the current model of healthcare, the current model of healthcare has two primary focuses. The first one is to ease suffering. And this is not my suggestion. This is what is actually said by they themselves. One is to ease suffering, and two is to save lives. Now, those are the two pillars upon which our current health model stands. And those are good, noble, and laudable places to be. Because if you can't, what quality of life can somebody have if they're suffering? You know what I mean? And if somebody is having an issue that could potentially kill them, you want to have the intervention of your healthcare system to be able to save that person's life. But what the healthcare system is not designed to do, it is not something that is designed to move you up toward wellness. It is not designed to move you uphill. It is designed to prevent you from moving downhill. Do you see the difference? Now, let me say it one more time. The current health model is designed to prevent persons from moving down toward death and disease, but it is not designed to move you up toward optimal health and wellness. And that's an important point to recognize so that we can make the most out of this system. We can get the most out of it. We can utilize it to the maximum. And many persons are often disappointed when they go in search of optimal health and wellness and are told that there is nothing that the healthcare provider can do for them. So that is the first thing. Now, if you understand when I talk about the healthcare system is based on a model that we call is an illness care model. It's a sick care model, meaning that the model is centered around the patients. Patients have to have an issue for them to be patients. And because of that, the system is geared around the sick person. And by default, that's how it is, but it's a necessary situation because of what the focus of the model is. So as a consequence of that, the first point that we have here is that sick care is reactive. What do I mean by sick care is reactive? And I want you to actually chime in by writing in your chat section, what does it mean what do I mean by reactive? Or what does it mean when it says that sick care is reactive? That's the first thing. Secondly, if we want to understand true healthcare, you cannot simply wait until something has gone wrong and then respond to the thing that has gone wrong. That's what reactive means. We are responding to something that has broken down. The reason that is not a good idea is that for some persons, the thing that goes wrong is something that can either kill them, it can lead to a permanent disability, or it might lead to prolonged and unnecessary suffering. And so if it is up to us, we want to not wait until something has gone wrong before we start thinking about our wellness position. We want to do things in anticipation of and so as to prevent it. And what do we call trying to preempt something before it goes wrong by putting in measures to prevent it from happening? What do we call that? Being what? Not reactive, but the opposite of reactive is, wait for it, be proactive. And that is the true healthcare model. The healthcare model about which persons are trying to attain optimal health is based upon the understanding that if we want to achieve optimal health, we can't wait until something goes wrong first. We have to ensure that we are preventing things from going bad in the first place. And so it requires a more proactive approach. And as the Jamaican saying goes, an ounce of prevention is better than a pound of cure. Some people just say prevention better than cure, but you understand the actual saying. Now, we are in a healthcare crisis. If you did not know before, we are in a healthcare crisis, not just in Jamaica, globally. And this crisis is based on the fact that we are spending more money on healthcare items, but we're getting less in return. Do you realize that the cost for healthcare services or accessing health services are going through the roof? The number one reason for personal bankruptcy in the world, the number one reason for personal bankruptcy in the world, do you know what that is? Well, if you guess healthcare costs, then you're absolutely right. Healthcare costs is the number one reason for personal bankruptcy. In other words, is the number one reason why people go bankrupt from their personal accounts, not a business account, a personal account. And so we have to be very, mindful of that. And the reason is we are trying to solve a problem with the wrong solution. If you are going about the solution the wrong way, it doesn't matter how hard you try, you will not succeed. And right now, the number one reason that people go to seek healthcare services or health services is not because of emergency situations like accidents or infections even. The number one reason that people seek out emergency health services is lifestyle diseases. Lifestyle diseases are the main reason why people access healthcare services. Now, how can you solve a lifestyle problem with drugs and surgery? You can't. You can't solve a lifestyle problem with drugs and surgery. You need a lifestyle solution. In other words, the only way to solve a lifestyle problem is by modifying the person's lifestyle. You have to live in a different way. And in order to do that, we have to change our behavior. Now, changing behavior, if you're focusing on the behavior itself, is very difficult to do. But the good news is that we don't have to focus on changing the behavior. We just have to change the way we view the world. Our worldview is what drives our behavior. And there are two competing worldviews as it pertains to the way people think about health. The one worldview is the illness care model. That's the one worldview. The second worldview is according to the wellness care model. Remember, we said illness is moving toward death and disease. Wellness is moving up toward health and vitality, optimal health and vitality. So in the illness model, how do we think? Well, this is actually the way that most people think. And I want to, hopefully for those listening here, we can break the way you think about health from simply being a illness way of thinking to a wellness way of thinking. Now, the illness way of thinking is actually taught to us. It is counterintuitive, and so they have to do a lot of marketing to train people to think in accordance to the illness model. But the problem with the illness model is that it's easy to think that way, but it's counterintuitive. In other words, we won't naturally think that way, but we have to be coached or trained to think in this way. So here we go. The first thing is, when you have a headache, for example, I'm using those who suffer from headaches, and we say to you, you know what? Well, you will often say, well, you know what, I'm having a headache. The first thought that come into people's minds when they have a headache is, what do I need to take to feel better? Isn't that true? We are content with the notion of feeling better, not understanding why we're having it in the first place. Just simply want to feel better, thinking that if we feel better, we're actually going to be doing better. When the reality is that most of the times you can change the way the body works so that you don't feel pain, but the problem persists. You know what's wrong with not being able to feel pain, but the problem that's causing pain is still there? It causes delayed appropriate action. You will take a longer time before you act appropriately, which means you would have probably lost valuable time and gotten sicker and sicker in the process. You know what's better than just simply saying, you know what, I have a headache, I want to feel better, or what can I take to feel better? If you ask a very different question, well, subtly different. Rather than asking what I can take to feel better, why don't you ask, what do I need to do in order to get better? Because I don't want to just simply feel better without getting better. I want to get better, because getting better is more valuable. How about this? Get well soon. Have you ever used the expression get well soon? Getting well is not a destination, somewhere to arrive at. I want to get well. I want to get some money. If somebody says, I want to get some money, you know what they're saying? They're saying they don't want to work. Bottom line. If you're saying you want to get money, it means that you're hoping that one day some money is going to just drop into your lap or drop into your account without you working to put it there. If you are saying you want to earn money, it's a different thing from simply saying you want to get money. You understand the difference? And so to say you want to get well is saying that you just want wellness to just drop into your lap. It does not work that way. You have to do meaningful actions that will move you toward wellness. It doesn't just happen by chance. And so, rather than simply saying I want to get well, how about this? What do I need to do in order to stay well? If that becomes the question that we ask, then immediately we'll conjure up in our minds a very different approach. And that is important. Let's move forward again, because staying alive is the measuring stick that they use now to determine how well the system is doing. Because we hear things like, you know what, we have more old people now thanks to modern medicine. Bottom line is, it is erroneous for modern medicine to claim the old people that we have today. In fact, I'll go a step further. The average 100-year-old person right now, the average centenarian, I will say is healthier than the average 80-year-old person right now. And what do I use to measure that, and what do I use as my yardstick? Why I say that? What I use to measure that is the fact that the average 100-year-old person is not on a lot of medication. They might be on 2, maybe 3 different medications. Usually, when you're on a bunch of medication, you don't reach 100. But what's interesting is that the average 80-year-old is on 8, 10, 11 different medications. And some of these medications are to counteract side effects of other medications. I don't think it's a good idea to keep mixing things that have multiple different possible outcomes. I'll give you a mental picture in point. Have you ever seen somebody balance by standing on top of a ball? It's not easy to stand on top of a ball. So if you have a ball, hey, I have a ball right here, and you try to stand on top of that ball to balance, it's not easy, but some people can do it. But what if I add on top of the ball something else and then ask you to stand on top of that and try to balance? Better yet, what if I added, let's see, I don't want to show too much of what I have here. Alright, let's just use this remote control. And I put this on top of everything else. And now I stand on top of that and I have to balance on all three. Even for me to do this here is not that easy. This is easier. This is easiest. I use that because here's what happens. When you have only one entity in a system that has different outcomes possible, it's predictable. It's easier to adjust or adapt to one entity that has different possible outcomes. Hence, one medication. When you add another medication into the mix, and then another, the addition of more medication makes it more unpredictable the way that they will all interact within the same person together. Even if you understand the interaction of each entity, the combination changes the chemistry. So the drugs don't remain as separate entities with their own separate active ingredients not interacting with the others. They all interact with each other. So how can anybody tell me that it makes any sense whatsoever to put any individual on 6, 7, 8, 9, 10, 11, 15 different medications? In my mind, and this is my opinion, it doesn't matter if you're giving them something for each medication that you're prescribing is for a definite need. The fact that you're putting all of them together in one person will change the chemistry of all of them. And so you can no longer predict what will happen with that person or whether any of these drugs will be doing the thing that they're supposed to be doing in the first place. So we have to think very differently when it comes to our health, and not just to accept things because we're told to accept it by our healthcare providers. So rather than simply looking at how long people live, a better measure of the wellness paradigm is how well you live. Instead of saying staying alive, how about feeling alive? That quality of life, that is way more important than simply feeling alive. Now, pain is something that most people do not like. I don't like pain. I will not tell you for a moment that I like pain. But pain has a purpose. And that purpose, as we've indicated here, is to alert us that something has changed and requires our attention. That is the purpose of pain. Now, whether pain is good or bad is its own debate. But pain has a role to play. And that's why we have that mechanism that causes pain, because it alerts us. It's one of our alarm systems that we have in our bodies to let us know that something is off. The problem is that pain is not a very reliable alarm system. For example, you can have a disease like diabetes, but there is no pain to alert you. Certainly not in the early stages that diabetes is developing. Or cancers. Cancers can develop in your body and can be very large in your bodies without any pain associated with it at all. Think about a woman who finds a lump in her breast, or a man who finds a lump in his breast. It is almost always a non-painful lump, meaning that there's no pain associated with it. Now, because pain doesn't always warn us, if we are the kind of person to wait for pain to tell us when to go to the doctor, we may end up dead before the pain comes on. So we have to be very mindful. All right? Now, that is the problem with pain. And that's why you can't trust pain to tell you when something is, because it doesn't always tell you when something is wrong, you see. Good health doesn't mean that you're feeling good. In other words, if you're feeling good, it doesn't mean that you're healthy. Feeling good just means that you're not suffering. If you want to know if you're healthy, your body has to be functioning appropriately. And the only way for you to know if your body is functioning appropriately is for you to assess. You have to test. And that is critical. Critical. So we have to trust the way our body is working, not the way it's feeling. You see? Trust the function, not the feeling. That's important. Now, there are different systems of the body. And I'm just going to talk about 10 of them now. And I just point them out as we go along, because I want you to be aware of them as we go through. So the different systems are: 1, the immune system, digestive system, nervous system, musculoskeletal system, cardiovascular system, integumentary system, respiratory, endocrine, reproductive, and excretory system. These are the different systems of the human body. Now, if any one of those systems is not working properly, you are not healthy. So I can even ask you this way. If all the systems are working except your digestive system, would you say that you're healthy? You can't digest your food properly. How about this? All your systems are working except your respiratory system. Lungs, airways. Can't breathe properly. Can't be healthy. How about your musculoskeletal system? You have arthritis. You have rheumatoid arthritis. You have lupus affecting your musculoskeletal system. You can't be healthy. There's no one system, if it's not working, would mean that your body can still remain healthy. Every system has to be working and working appropriately for you to be considered to be healthy. Isn't that important? Isn't that interesting? Now, even though all these systems are important, there is one system that's actually probably even more critical than all the other systems as we look at them. Which system is that? Which system would you say is the most, well, not the most important, but is the system that governs and regulates the function of all the other systems? Because there is one system that does that. And that system we call the master control system. I'm going to give you a second here to answer that. Which system is that? It governs and controls the function of all the other systems. Well, that system is called the nervous system. That system is called the nervous system. Very good. Who got that one right? Who is Derryberry? Darian. Well done, Darian. Well done. First person to answer that one. Now with the nervous system, check this out. Because this next point is I think probably the most important point to watch. So watch carefully, alright? Because I'm gonna show you something here that's very important. If you look at the nervous system, it consists of the brain, which is a major organ of the nervous system, and the spinal cord, which is basically a continuation of the brain that runs down into your spine. Every organ of our body, every single organ has a nerve supply to it. You see these yellow things here and these blue things here, these are all nerves, and they connect the brain to whatever body part you're looking at, because it's the brain that controls the function of the body part. Well, it ensures, it doesn't necessarily make everything work, it just ensures that they work appropriately when you compare it to your environment. Yes, there are some systems that interact with the environment directly and is not under the control of the brain per se. But even that is not entirely true. I'll give you a case in point. You know when you're nervous and your heart starts to beat fast, or you're hot and you start to sweat, you know that there are persons that can train their minds so that these external stimuli don't create in them the same effect. How could that be possible, to train your mind to control something like sweating, if sweating is not controlled by the brain? It has to be. The only thing is that yes, it's controlled by the brain, but it is not a part of our what we call volitional control, meaning that we don't have deliberate control over many functions of the body. The organ functions of the body are not under our voluntary control. They are under what we call autonomic control or automatic control. So that is important to point out, right? Now, looking at the body, there are things that we need to start understanding now, and that is one, the nervous system is the mass control system. If you look carefully, you will see that the nerves that control the body, most of them exit the spine in order to do so. And as it exits the spine, if there is, and I'll try to show you using the model that I had already up, these nerves have to exit the spine to go to the organs that they control. If you have a problem with your spine that irritates the nerve, you can affect the function of the organs. You can affect the function of the body. So much so that many persons who have had traumas, like physical traumas, like a car accident, for example, they end up with symptoms of an organ nature. For example, rapid heartbeat, or your heart starts to race. Has anyone ever had a car accident and then years later they notice that their heart starts racing for no apparent reason? Or their blood pressure starts to get elevated for no apparent reason? Or they have poor digestive function for no apparent reason? Or they have poor urinary control for no apparent reason? You see, the problem is that most of us don't realize that most of the things that affect us today, that we're taking a pill for, is not because of a disease process. It's not because of pathology. That's what we call a disease process. It's not because of pathology where the organ has gone, has become diseased. The number one reason that people actually go to doctors are for things of a functional nature. It's just that things are not working the way they're supposed to work. You know, when you eat your food, the acid is coming up back in your esophagus, or you find that you're having when you're supposed to be breathing, your airway is not opening properly, and so you find yourself fighting for air or gasping or wheezing, as in the case of persons with asthma. These oftentimes are functional changes. And you know the difference between a functional change and a pathological change is a functional change is a normal function at an abnormal time. See, it is normal for your heart to race if you're running up the stairs, but not when you're sitting there not doing anything. It is normal for you to have elevated heartbeat or blood pressure. If it is that you're exercising, your blood pressure will go up. So changes in our function usually follows a pattern where it becomes abnormal for the circumstance under which it is performing its role, not because of a disease. That is interesting to note. All right, let's move forward because I want us to be able to finish up this point. A subluxation is what causes nervous system dysfunction as a result of a spinal problem. So when you're in a car accident and these things start happening later on, it's usually because you've irritated a nerve that controls the function. What's the easiest way to irritate a nerve? The easiest way to irritate a nerve, and it happens the most, and it's also the most common way, is by way of a spinal misalignment. In other words, you've had something happen to you. It didn't fracture anything, but it shifted things out of its place. Now, there are three ways that a bone in the spine can be subluxated or misaligned. Well, we say misaligned, but it's really subluxated or have abnormal function. One is if the bone is not in its right position relative to the bones around it. That's what the misalignment is. That's one way that you can have a subluxation in your spine. But it's not the only way. Another way is if the bone of the spine is not moving at all. In other words, it is fixed or locked up in its location. So all the bones of the spine should move relative to each other. If one bone doesn't move at all and becomes fixed, and the other bones are moving, then that fixed bone can create a problem for the spine. And so the other areas have to move more to compensate for this motion that is lost. So bones are either out of place or stuck. The third way is if the bones are moving abnormally. It is not stuck, but it's not moving the way it is supposed to move. So when it's supposed to, let's say this bottom bone here, relative to this top bone, when you tilt this way, this should tilt that way. And when you tilt that way, this should tilt that way. What if when you tilt this way, this tilts that way, and your spine is doing that abnormal motion? Or when this is turning this way, this should also turn that way. What happens if this turns this way, but this one turns the wrong way, or doesn't turn at all? Those things create irritations in the spine that will disrupt proper function of the nerves that have to exit between the bones of the spine. I'm going to show you a picture real quick because I want you to see the next slide that speaks to this. If you look at the third bone from the top, this bone here, the middle bone, is a misaligned bone. And look what happens to the nerve that exits that bone, where that bone is. If you shift that bone out of place, you're going to close off the opening where that nerve comes through. And what happens if that nerve controls the rate of the heartbeat? Then the heart won't beat appropriately anymore. So when the brain is going to be telling the body that, oh, we're exercising now, or that a gunman is in the room so that your heart starts to beat fast, the signal doesn't get to the heart appropriately, and so the heart doesn't respond the way it should. Or something is telling the heart to beat faster in a time when it's not necessary for it to do so. This is how things work. Now, there are three different types of stresses that will cause issues as it pertains to our health. One is the physical dimension, two is the biochemical, and three is the psychological. Those are the different ways that the body can undergo a stressor that impacts the way the body works. The physical is like a car accident or a fall. Biochemical, like things that we put into our skin, on our skin, in our mouths, things that we eat, ingest, whatever. And the psychological, the way we think. These are the ways that impact our function. And when I say the way we think, if you're in a bad relationship or you're in a stressful job, it affects the way you think, and that kind of impact can cause stress to come to bear. All right, I hope that makes sense. Now, the nervous system is what improves our ability to adapt to our stresses. If our nervous system is working properly, which is primarily the brain, it is our brain that perceives the stresses in our environment. If your brain is working properly, then you can adapt better to your stresses. If your brain is not working properly, you don't adapt well to your stresses, and that's important. I'll kind of skip through this slide, though important. I want you to understand how chiropractic works. You see, what we do with chiropractic here is that we realign the bones of the spine so that there is as little interference to the proper functioning of the nerves as possible. That's what chiropractic is all about. It's not about the bones per se. Chiropractic is about realigning the spine so that the nerves that exit the spine are working at their optimal, in as much as it depends on the spine, right? Because there are things that are not related to a misalignment that can affect the function of the nerves. So in that case, chiropractic won't necessarily be the answer for that problem. So chiropractic is good. Now, as we indicated, a healthy nervous system is what allows us to adapt to our stresses. Now, the word gap, as was explained in the previous slide that I did not go through with you, is our general adaptive potential. So the better our nervous system is working, is the better we can adapt. The better is our potential to adapt to our environment. At Gardner Chiropractic and Neurology, our office, we are focused on trying to identify these subluxations wherever and whenever they happen in the spine because of how important it is and how it impacts the function of the human existence. And so when we look at it, to do that, we have specialized tools that help us. We have a rolling thermal scanner that measures skin temperature along the spine. And we have a surface electromyography, which measures electrical muscle activity in the spine. These are important. Now, these help give us clues as to how the spine works. These give us clues to help us to understand how the spine works. But it's not an end-all, be-all, right? It's just something to assist us, right? Now, if chiropractic really does what it's supposed to, what we claim that it does as chiropractors, then there has to be some way of assessing the function of the nervous system in response to the chiropractic adjustment. And there is. The number one organ of the nervous system is the brain. And there is this very cute study that I like that demonstrated that the adjustment does impact the brain's function. So as we look at it, this lady was asked to wiggle her left ankle. and then they took a picture of her brain. Now, for this woman, they took a picture of her brain to compare what's happening before the adjustment to what's happening after the adjustment. And this is what we saw. Areas of light are areas of activity in the brain. And so when this person was asked to wiggle her ankle, all these areas of the brain lit up, which should not be. Because the right-hand side of the brain, which is this side of the brain, is responsible for a function on the left-hand side of the body. And so that should require a lot less involvement. And we're talking about the initial thing because the brain is kind of cool because the brain, I'll leave that alone. The brain is cool though. Now she was given an adjustment of the spine of the neck, the cervical spine, and asked to repeat the task, and this is what they saw. Fewer areas of action, of activity, which means for this person, her brain was way more efficient after the adjustment than before the adjustment. Interesting, huh? And so, what do we say? We understand from this study, and there are many other types of tests to show that adjusting the spine impacts the brain. But chiropractors, I don't want persons going forward to misunderstand, because there are many people who, when they are asked, what is a chiropractor? They say it's a bone specialist or a bone doctor. No, a chiropractor is not a bone specialist, and a chiropractor is not a bone doctor. A chiropractor, what we do, we work on the spine by realigning the spine to correct the function or the motion of the bones in the spine. By doing this, it improves the way the nervous system works. So in essence, the chiropractor is more of a nervous system doctor than a bone doctor. So bear that in mind. Now, I'm a chiropractic neurologist, right? And all chiropractic neurologists are chiropractors first and then neurologists second. When we say chiropractic neurologists, we're talking about the branch of chiropractic that deals with more brain function than anything else. And the way we treat brain situations as opposed to a medical neurologist utilizes more medications in their interventions. We utilize more therapies and exercises, brain-based exercises, to rehabilitate specific parts of the brain. And that's what we do. And that's how we are different, right? But a chiropractor realigns the spine, and we're all trained to realign the spine. Whereas a chiropractic neurologist has specialized experience in retraining the brain. So chiropractors realign the spine, chiropractic neurologists retrain the brain. These are some examples of things that we treat or have treated here at this office with varying degrees of success. So it's a fascinating thing, and it's especially fascinating when we see lives transformed. Our vision in Gardner Chiropractic is threefold. One is to identify subluxations wherever and whenever they happen, to provide a program of chiropractic care, and to educate our community. And when I say a program of care, one adjustment or one chiropractic intervention is not going to fix everyone or anyone. It has, but usually that's not the case. So we put people on a program of care, and one phase of care is usually about 12 sessions long at our office. And based on those 12 sessions, we track your progress, do an update exam at the end to compare before and after to see if you're doing better, so that we know it's not just a matter of you feeling better, you're actually getting better, right? That's important to us. Now, who's responsible for getting and staying well? For you. It is your responsibility, so you have to take that responsibility. You are also responsible for the health and the wellness of your kids, if they are minors, and anyone you have direct control over. So please understand that it is so very important. Now, we have testimonials that we have on our page, on our YouTube channel. So if you've joined us here, I encourage you to watch through some of our videos, watch through some of our YouTube channels, YouTube testimonials, and some of the audio is not so good in some of them, but listen to them and see what we find out, right? Awesome, awesome, awesome. Now, we have a very special offer for those of you that have made it to this point. But I just go ahead and state that if you are, if you've been on this platform and you have not yet indicated your name, we're going to ask that you please state your name. Please state your name. Because that's how we're going to know that you were online and you can benefit from the offer that is being made. So please state your name. So here we go. For those of you who are watching us tonight, if you are currently a patient of ours, then there's nothing further you have to do other than to ensure that we see your name in the chat. But if you would like to come in for an examination, you've heard us and we recognize that pain is not necessarily going to tell you when everything is wrong. So whether you're in pain or not, if you want to find out the current state of affairs as it relates to your spine, we're offering you a special discount of 40% off the new patient examination. So that way you can really take advantage without it cutting too much into your pocket. The good news though is that there's no time limit on this to be taken up. So if you would like to, you can always schedule it for next year sometime. In fact, I don't think it's even possible to do this before the year is done because of when our next new patient availability is. But if you want to take advantage of that, that 40% is yours. All you have to do is to send an email, and I'm typing the email in the chat, and tell them that you would like to get an appointment from the patient health workshop. All right, so just do that. And they will make sure that they set that up for you. Very important. All right, so we're moving again. What if you're an existing patient? What if you are already a patient of mine? Well, if you're an existing patient, meaning that you've already come in for an examination, you will get a 20% discount off your update exam just for participating in this class. And remember, the only way that we will know that you participated is by you indicating your name in the chat. So you don't have to send off an email. The email is for those who want to make an appointment. But for the existing patients, you have to just make sure your name is mentioned in the chat. So you get a 20% discount off your update examination. You get a 20% discount off one treatment per person that you refer. So if you refer 5 people, you can get a free treatment. But it's not 20% off every treatment. 20% off one treatment per person that you refer. And you will get an additional 10% discount off the entire next phase of care. And it doesn't even matter if you're getting other discounts already. we oftentimes combine discounts for people. So if you are, let's say you're getting a student discount, or a senior citizens discount, or a teacher's discount. If you're getting one of those discounts, then and you've watched this um, class, then you will get a 10% discount on top of whatever discounts you would have already been getting for being one of those special category of people. And for those of us, those of my Wilmerian friends, we don't have a Wilmer's discount, unfortunately. Um, so there you have it. So we've come to the end of our show. I just want to point out something here for you. If you would like to follow us on social media, and I think you can access our Instagram via Facebook as well. But our Facebook or YouTube, our website is gcnjamaica.com. Our Facebook address is GCN Jamaica. Our Facebook handle, GCN Jamaica. Our YouTube handle is Gardner Chiropractic. Our Facebook handle for our radio program, because we have a radio program, it's called Back to Health Talk Show. Back to Health Talk Show. And this radio program is on Tuesday nights at 9 p.m. 8 p.m. 8 o'clock to 9 o'clock Jamaica time. It's a 1-hour show on RGR 94 FM, but we stream it live on Facebook for those who want to join us that way. So that's what that is. So for all of you, if you haven't yet subscribed to our channel, please go ahead and subscribe to us so that we can know that you care. And the bigger our numbers are, the better the more people we can reach, and so on. In fact, I'm starting a new thing come 2020, where every 5th Thursday of the month, if the month has a 5th Thursday in it, we shall be having a showtime with Dr. Gardner, where we are going to show you different videos that I like. So tune in for that, and we'll send out announcements for that. But make sure you have subscribed to be able to receive those benefits. It's indeed been a pleasure talking with you tonight, and I do hope that you learned something and that you would have benefited from the class. We don't have much of a Q&A tonight because I have another engagement I have to attend to right afterwards, but thank you so much for joining and participating. And the next Patient Health Workshop class is on December 17th. You are welcome to join us again for that. If you watched it already, you're welcome to watch it as many times as you'd like. Or you could share the information with other persons. So that is the 3rd Thursday in December. That's 2 weeks from now at 6 p.m. Jamaica time. All right? So thank you so much for participating, for joining us. It is my sincere hope that you got something from this and that you enjoyed your time with us. I certainly did, and it's been a blast. So God bless you. Have yourselves a wonderful night, and I look forward to seeing those of you who are my current patients, seeing you very soon. May God bless and keep you.